Hello everyone, my name is Abel Mwale and I'm going to be sharing with you a few updates on the Society of Anaesthetists of Zambia. Currently, I serve as president for our society. Well, this is basically an outline of how my presentation is going to be. I'll give a little background of how it all began, and then I'll talk about society and member activities, and then what we consider to be some achievement that we have achieved during the past few years. So, Society of Anaesthetists of Zambia is probably one of the oldest societies to be registered ever in Zambia. And our registration, according to paperwork, it dates as far back as 1972, when our expatriate doctors and anesthesiologists were here. Now, within the same year, as you could see from what displayed there, the then president, Dr. Kasale, was able to ensure that SARS became a full member of WFSA. And interestingly, within that same year, they managed to hold their first ever anesthesia congress. But of course, over the years, the experts had to leave at some point, and then the Zambian doctors, headed by Dr. Daka, were able to take over the mantle and ensure that the society was able to discharge its duties. And so Dr. Daka ensured that even using his own money, he maintained the society as a member of WFSA. And of course, there were very few anesthesiologists in Zambia then, and so the activities of society may not have been as vibrant as they would have wanted to be because the numbers of anesthesiologists were very few. So it was until 2016 that the society saw a rebirth and re-registration with the Registrar of Societies. So in 2016, the interim executive was formed, and that took over from Dr. Daka. And then we immediately realized that we had to change the narrative. We had to change our own narrative and thrive in our settings. And changing that narrative implied shifting the paradigm as regards to policy guidance and formulation, training and education, as well as collaboration and funding for the society. And of course, to just make the society relevant to its members once again. So in 2016, the then executive managed to hold their first ever anesthesia congress, with themed meeting the challenge in obstetric anesthesia, intensive care, and regional anesthesia. It was an international conference, and we had people come as far as Germany to come and present and attend our meetings. Now, straight on, we realized that there was supposed to be, like mentioned, the paradigm shift in the way leadership was done, but also see how we could guide policy at the level of the ministry and a bit more. So regarding that, SARS has therefore continued to be a strategic partner and strategic formulation of national strategic plan and many other aspects within the region as well as within the country. So for example, our society was involved in the development and implementation of the first ever Zambian National Surgical Obstetric and Anesthesia Strategic Plan. And even as today, the reviews are being held, society has continued to be a strategic member in the continued revision and implementation of these strategic plans. To this effect, various working groups have been proposed that will be handling various aspects of these strategic plans. Well, apart from that, Society of Anaesthetists of Zambia also is an advisory to the Zambia Medical Association, which is a body that basically governs doctors in the country in terms of practice, but also membership. And under this, the Society of Anaesthetists of Zambia serves as an advisory, but also as a membership role. In Zambia, our profession is regulated by the Health Insurance Council of Zambia. This is where they registered all medical practitioners, basically. And so as regards anesthesia, our society serves as an advisory, but also as part of the ones who are enforcing the standards of practice of anesthesia within this body. And a couple of years now, under the Ministry of Health, there was a college formed, Zambia College of Medicine and Surgery. This college is aimed to training more doctors in specializing in various fields. And society was opted as one of the trainers under this program. Well, internationally, our society is very well represented too. For example, in the African Regional Section of Anesthesia, or WFSA rather, Dr. Mwale sits there as the Secretary General, representing, of course, our society. And WFSA also consults us, and we do consult in many other trainings, such as safe courses. And Dr. Mupasha currently sits as the Secretary General for Canexa. Canexa is basically similar to what COSEXA is, but only Canexa trains anesthesiologists and not surgeons as COSEXA does. And so the member countries are the same as for COSEXA. So even under this one, Dr. Mwale also serves as education committee member and country representative for this. And so SARS is still trying to see how we can continue being relevant to our membership, but also influence policy direction within and without the country. Well, training still remains one of the major focus of our society. And under this subheading, we've developed various programs that have aimed at increasing the knowledge as well as sharing and transfer of knowledge. So some of the things done under this are, for example, mentorship. There have been various mentorships that have been done with various partners, and some of those that we mention a few others that might not be mentioned in here. There's, for example, a low flow, volatile steroid. Now, this was aimed at teaching anesthesia providers in the use of inhalation agents. And this was, of course, in collaboration with SARS, Ministry of Health, and AVUL, in this case, providers of the inhalation agents. There was another one called Sage Africa, which is basically safe surgery and safe anesthesia. It was a collaboration of many other partners, and this aimed at training or mentoring all members of the theater team, starting from anesthetic porters, theater porters, nurses, theater nurses, the doctors themselves, and every member of the team. And of course, SARS was involved in this, and individual members of SARS were also tasked with the duty of making sure that the KPIs for this project and our society was actually achieved. And recently, there was a development of basic critical care course, and this was basically meant to be taught to nurses or any other people, doctors, and anesthesiology providers who are taking care of critically ill patients. And this course, both the development of the curricula as well as the implementation of it was done the membership of SARS. And similarly, under partnership with the WFS, World Organization, as well as Ministry of Health, SARS was also involved in the development of curricula for COVID-19 critical care. And of course, this is a specific need that arose due to the raging pandemic that is basically affecting all of us. And well, apart from that, there's been some projects that SARS have been involved in with borders on still mentoring, and this is one of them is a partnership that was between SARS, Ministry of Health, and GADP, as well as Stonage. This was reading the Saving Lives at Birth project, which GADP Health Systems won. The focus in this project was basically to mentor basic people who are taking care of mothers and newborns. So the innovation that was being enforced here is the use of universal anesthetic machines and what is called a comprehensive care ventilator. So these trainings were involved in hoping to ensure that probably there would be a reduction in the maternal and newborn mortalities within the region as well as in the country. Our members have continued to be involved both as a society and individual members in various trainings that have taken place within the country and outside of it. And what we're proud to mention among them is that our society and membership have been involved in the development and implementation of various curricula that have been now adopted within the region. The basic critical care course mentioned earlier has seen about over 300 people trained. These are medical providers trained in the handling of critical care patients. Now, these trainings were having about 30 to 40 per session. There were about 15 of them conducted, and the training of participants were gotten from various fields such as nursing, the physicians, the surgeons, and any other cadre who found themselves taking care of critically ill patients. Then recently and ongoing, there's been a development of simulation-based curricula for training critical care providers on the use of a comprehensive care ventilator, which is also developed by GADP Health Systems, as well as simulation-based training for the use of universal anesthetic machines in the various settings in the country, especially those areas with poor power supply. Other projects that have been ongoing are the regional anesthesia project, which is emphasizing on the use of regional anesthesia and also training anesthesia providers on how they can be able to use regional anesthesia in their discharge of their duties. A respiratory project has also been instituted, which is still ongoing. This is aimed at also equipping anesthesia providers and those who might be taking care of critical ill patients on how to handle the airway, but also how to use some of the ventilators that might be found in while they're working. We have got ongoing safe courses, and currently, as we speak, as this conference goes on, we have one safe pediatric training going on with Dr. Mpasha right now. As regards academic activities, despite the raging pandemic, SARS with its partners have ensured that academic activities, both in setting exams and executing them, has continued both virtually and physically in other areas. We're thrilled to have first graduates from the College of Anesthesiologists of East, Central, and Southern Africa, or in short, CANEXA. So CANEXA has member countries from Zambia, Kenya, Malawi, Zimbabwe, Eswatini, Rwanda, and Tanzania, and as well as Uganda. So the idea is a similar concept to what COSEXA is doing, where they train surgeons within the region. And this has enabled us to see how we can be able to know that our anesthesia training is similar to within the region, and therefore also upping the standard of what our trainers should be. I would love and be glad to mention that the best graduating students from this graduation is actually our very own Dr. Imran Ahmed from Zambia. In 2021, also we saw 5 MA trainees satisfy all requirements for the graduation of obtaining a degree of Master of Medicine, Anesthesia, and Critical Care under the University of Zambia. Now, since inception, we find that about 30 anesthesiologists have qualified since the training began in 2011. Currently, we have 12 trainees currently undergoing this program, and we're expecting about 4 new ones to join the caravan. Unfortunately, 2021 wasn't all about achievements. We had a huge loss, which was experienced by basically Zambia and the globe. The loss of the death of our mentor lecturer, as well as one of the founders of anesthesia in Zambia, Dr. Zakota. He really played a huge part in our training in anesthesia in Zambia, and also came back to continue the training. In fact, before his death, Dr. Zakota was serving as the chair of the education committee, which he handled very well. And the role that he did is actually definitely left a void in me. And so his wish was that we be able to improve on our supervision in Zambia. And to bear witness to what his wish was, even after his death, his family donated quite reasonable amount, so to speak, to SARS for the purposes of having what we call now the Anton Zakota Scholarship Fund that is aimed at helping young anesthesiologists in training, both in their research as well as meeting their requirements financially during the training. And so we do hope to carry on his legacy by continuing to support these young developing anesthesiologists within the country. We have continued to partner with various partnerships. We have quite long-standing partnership with the Ministry of Health, that's for sure, being a provider and custodian of health in the country. And we have partners with the Global Anesthesia Development Partnerships, which has been very helpful in ensuring that our training on anesthesiologists in Zambia continues without later, both virtually as well as physically, before the pandemic was raging. But others have risked their lives even during this pandemic to help in offering training to our trainees. CANEXA also, one of the platforms that has been quite helpful in ensuring that we continue this training. And so we're looking forward to developing more partnerships with other people in fostering provision of anesthesia in our country. So where are we going from here? Well, We realized that obviously awareness is something that needs to continue going on. We need to increase anesthesia training positions by collaborating or talking to the Ministry of Health, who could be able to probably allow more positions for training in anesthesia. We need to do more collaboration within the country and outside the country. I need to continue improving the safety of anesthesia delivered to our population. We cannot re-emphasize the need for research in achieving all these goals listed above. We want to think global budget outlook. Even within the region, we do know that there could be specific differences. There might be challenges that might be generalized, but there are those challenges that might be specific either to a facility or to a region within the country. So we also need local evidence to inform our practice and decision making, so that we're able to act on evidence that is based on what we know. And also we need to implement sustainable, locally relevant interventions. That can be done at the moment. We know where we want to be, but before we get there, there are stages that we can't skip, unfortunately. And so we want to be realistic and also implement sustainable but locally relevant interventions. This also entails sharing valuable information and resources both locally and regionally. And this will end up giving us a vantage point as we advocate at different levels of improvement in healthcare service delivery and research. Well, the year hasn't been without challenges. And of course, the first thing is assets versus money, and of course, funding. So funding, of course, we still need funding to help in discharging of the various duties, but also various projects that are ongoing, but more importantly, training. And so we focus on simulation equipment that can aid in our training, artisan machines that can aid in our teaching of regional anesthesia, and then the ongoing safe ops and PIDS courses, which need full set for these trainings to happen, but later. Training anesthesia machines, currently anesthetic machine might not be the best that have for the training. There are some centers that might have good machine, but others don't. Therefore, this hampers provision of training to our trainees. Also, critical care ventilators on our ICUs. Some of these might not be as good as we'd want them to be because of training. So some of the areas that we find challenging there. But the most and basically the hardest one to solve at the moment is a human resource. We need more people to be trained as MSO providers to be able to offer the training to our students that we want. Now, this sounds like so much to be reasoned. It sounds like there's still so much work to be done, and probably there is so much work to be done in it. However, we are confident that at this moment, I'd love to introduce a new executive that has been mandated to ensure that all these things talked about are met, all those challenges are met, and all those goals we set for ourselves are achieved. I'd love to hasten to mention that the leadership that has been for the new executive, which took office in December, has been tried and tested. And so we are sure that all of these people bring something to the table and are equal to the task. So as you could see there, I'm the president of the Anaesthetists of Zambia, Dr. Sompo Mansa, Secretary General, Dr. Arthur Polela is the Treasurer, Dr. Charlotte Mutesa is a Public Secretary. I hasten to mention that she's still a student though. She's still active. And then Dr. Imran Ahmed is a committee member. This is the person who's our highest or the best performing students in the CANEX exams. And then we have Dr. Julian Chomba, who's a committee member. And like I mentioned, all these are already heading specific programs within society. And therefore, we have no doubt that their leadership would indeed benefit society. I'm going to end here for now, and we can get some questions if there are any.
Well, I'm going to say thank you very much to Abel. Unfortunately, Abel isn't able to be with us because he's actually dealing with a difficult case at the moment in theatres. But I'm hoping that we're going to have Sompo available, who's the Secretary General for SAS, to answer some questions. But first, I just wanted to say how amazing, proud, wonderful it is to hear all of that information about the Society of Anaesthetists in Zambia, because that didn't exist, before I went to Zambia, and they have done an incredible job of adapting to the difficulties and the change that's been required, especially over the last 2 years. And their integration with Connexa and doing all the training in critical care, I think, is fantastic. We think about the number of anaesthetists we have in training in the UK, and they talk about 4 or 5 coming into training, and yet they've managed to deliver all of that. So I'm just really impressed. And if there are any questions in the chat box, I think Sompwe has just come online. I can see her. So hopefully Sompwe is going to be available to take some questions. Hi, Sompwe.
Hello, how are you?
All right, how are you?
Good, thank you. Sorry, just a little busy today.
Oh no, you're looking beautiful in pink.
Thank you.
So Abel's given us an amazing summary of what SAS has been up to and how it's developed and the changing executive board. So I suppose, what have you found the most challenging things over the last year, Sompwe?
Wow, of course, it's been difficult because SAS is such a small organization. We're still really in the early stages of the society. So of course, things that require funding and things like that have always been a little bit difficult to mobilize. But I mean, having said that, we have a great membership who are very keen to get involved, who are willing to sacrifice time and sometimes money to make things happen. So, I mean, that's really been something that has been helpful and really motivating for myself as a general member, and then moving on to the executive towards the end of last year. So we're trying to see how we can move SAS forward, move the society forward, but of course, working with different offices, having to engage the ministry, it's proving a little bit frustrating just because they're not working at the same pace that we want to be moving at. So I think that's probably been one of the huge challenges in trying to achieve what it is we want to achieve.
And I think Sonia's got a question from the chat box.
Thank you very much, Sompwe. So this is a question from Julian at the WFSA. Julian says it's fantastic to see the huge efforts going into growing the numbers of anaesthesia professionals, including physician providers in Zambia and the EXA region. Thank you very much for your leadership on this. And then his question is, are these anaesthesiologists staying and working in Zambia? If not, what more can we do to ensure that we keep these specialists in Zambia and the EXA region?
So I think for the ones who have trained here in Zambia, majority have stayed in Zambia, though we have had a few moving into private practice. So the challenge has largely been from an HR standpoint. Of course, with an increase in the number of private institutions that are offering theatre services, they do want to have physician anaesthetists on board. And so it's really put pressure on government as an employer of choice for a lot of people, because now they're having the option of moving into private, which is really putting a strain on those of us who are staying in government. But having said that, it looks like things are starting to change. I think that there is a lot of work going into ensuring that people are enumerated appropriately, that people are being promoted appropriately, and that's something that we're very grateful for. And I think revisions are also being made according to like how much we're being paid at the end of the month and all of those things. So those are definitely steps that are being taken as far as retention within government service goes. Fortunately, we haven't seen very many. I don't think we've had anybody actually leaving the country to go work outside of Zambia, which is actually very fortunate for us. But of course, the HR conditions are something that we are trying to actively engage the ministry in, just to try and keep people on and keep them as happy as possible.
Thank you very much, Sompwe. That's really, really good to hear, actually, and very hopeful as well. There's another question as well saying, this is from Jane, saying, great presentation, and we're all very impressed by everything that SAS has achieved. What would SAZ like to be able to focus on in the coming year, and how can we support you moving forward?
So of course, having more trainees is always going to be a focus for SAZ. I don't think we're ever going to take that off the table. But some of the things or some of the areas we're moving into are things like how we can influence policy. Influence policy more. So we're trying to get involved with things like the NSOAPs, making sure that we have appropriate targets, making sure we're collecting that data. So I think a lot of the support that we're going to need is especially going to be in the region of data collection, so that we have baseline data for things like critical incidents, so that we have accurate mortality statistics, so that we have an accurate picture of inadvertent ICU admissions and PACU, things like that. So data collection and research are going to be really big for us this year, we are hoping. And then also we need to continue training. I think it's something that's been very important for SAZ, that we've been able to run as many courses as we have over the last years. But of course, they've been very focused in specific areas. So we want to see how we can empower some of our members who really have a passion and a gift for training to get out there and have more outreach to more regions of the country instead of just being focused in the major urban areas.
Great, thank you very much, Sompwe, and just a thank you there from Julian for your insights